We hear a lot about antibiotic resistance these days. So what is antibiotic resistance? It happens when bacteria change so that the antibiotics used to treat the bacteria become less effective and sometimes don't work at all. Why is this important? Because if certain infections become more difficult or even impossible to treat with antibiotics, Canadians may be sicker for longer and continue to spread these infections to others. We know Canadians are prescribed a lot of antibiotics. In 2013, nearly 23 million antibiotic prescriptions were dispensed by Canadian pharmacies. So it's important that Canadians use these antibiotics responsibly to help reduce the impact of antibiotic resistance in Canada and around the world. In fact, antibiotic resistance is one of the most serious public health threats to the treatment of infectious diseases worldwide because it makes treating diseases more difficult, more expensive, and leaves fewer antibiotics to effectively manage infectious diseases. With fewer or no treatment options, people can be sick for longer periods of time, and some infections, if left untreated, can cause severe complications or even death. In addition, people undergoing chemotherapy or invasive surgeries could be left vulnerable to infections if we no longer have antibiotics to provide protection. Sometimes antibiotic resistance can happen naturally, but a major contributor is the overuse and misuse of antibiotics. This includes using antibiotics when they're not needed, not taking antibiotics as prescribed, self-medicating, or antibiotic sharing. While resistant infections in healthcare settings are particularly worrisome, anyone can get an infection that is resistant to treatment. Many infections are not limited to healthcare settings and can be acquired in the community. Infections such as urinary tract infections, pneumonia, and even some sexually transmitted infections are among a number of others that are showing resistance to treatment. Just like other infections, treatment-resistant infections can be spread from one person to many others. Because of this, antibiotic resistance is a concern for entire communities. What can you do to limit the spread of treatment-resistant infections? Keep your hands clean. Keep your germs to yourself. Protect yourself from illnesses that vaccines can prevent. Clean common surfaces with soap and water. If you are sick, stay home. Store, handle, and prepare food safely. Practice safer sex. If you are prescribed antibiotics, use the antibiotics as directed, even if you feel better. However, if you experience a bad reaction or side effects, talk to a healthcare professional. Never share antibiotics with friends or family, and don't take expired medication. Dr. Gregory Taylor, Canada's Chief Public Health Officer, wants to remind Canadians that
antibiotic resistance is real. It occurs in Canada, and Canadians need to be aware of the risks associated with antibiotic resistance. Although resistance to antibiotics is a naturally occurring evolution as bacteria evolve, there are many steps we can do to mitigate the effects of antibiotic resistance. It's important that every Canadian do their part to help prevent the spread of antibiotic-resistant organisms.
To learn more about antibiotic resistance and what you can do to reduce your risk, visit Canada.ca/antibiotics.